helping you find the right care. A guide to our services. When to visit NHS Inform. NHS Inform is a website from NHS24. It offers health and care information, a wide range of care guides and Scotland's Health and Care Service Directory. You'll also find a range of advice and tools to help if you are looking for living and eating well tips, contraception or immunization information and help to stop smoking. Feeling anxious, stressed, or low, or having problems sleeping or dealing with grief? Find out how you can improve your mental well-being by hearing what others have found helpful. What if I can't get online? If you are well, but have a question about your health or services, phone NHS Inform on 0800 22 4488. Try our symptom checkers. Our online symptom checkers are a quick, safe way to get the advice you need. We will ask you a few questions. Once you have answered all of the questions, you will get advice on what to do next, and how soon to do it. You can also get advice about medications. The advice you will be given is based on the answers you have provided. This could be self-care advice, or advice to visit your pharmacist, speak to your GP, or to call 111. How symptom checkers can help. It can take as little as 1 minute to get answers to your questions. They cover common symptoms and reasons that people seek help. How symptom checkers can help. It can take as little as 1 minute to get answers to your questions. They cover common symptoms and reasons that people seek help. The most used guides include abdominal pain, back pain, urinary infections, and what to do if you run out of medicines. There are guides for low mood, stress, or anxiety and depression too. Where can I use the symptom checkers? Our symptom checkers, and information on when to call 111, are on the nhs24.scot homepage. You can also use the symptom checkers using our mobile app NHS24 Online. The app can also help you find the nearest health and care service, when it's open, and the contact details for that service. NHS24 Online is available for all devices and free to download. NHS Info app, Apple, or nhs24.info app, Android. Or scan the QR codes. When to call 111. The 111 service provides urgent care telephone support when you need help when your GP or dental practice is closed. We cannot make appointments for you at your own GP or dental practice. You think you need A&E, but it's not life or limb threatening. You need to visit a minor injuries unit for cuts, sprains or burns. You are experiencing mental health distress and need urgent support. What happens when I call 111? The first thing you will hear is a message with options to choose from. Listen carefully so that your call gets through to the right person for your needs. Please do not hang up and redial, as you will lose your place in the queue. Continue to hold and we will answer your call as soon as we can. Safety information. For safety, we will ask you for the following details about yourself or the person you are calling for. Name. Date of birth. Home address or the address where you are calling from. The telephone number you are calling from, and a number we can call you back on if we need to. GP's name and practice. Getting you the right care. We will then ask a set of questions to find out more about why you are calling. Our call handler will share your answers with a healthcare professional in our team. Together they will choose the right care for you based on the reasons for your call. You might speak to a pharmacist, nurse, or dental nurse. They may give you self-care advice, or tell you to attend your GP practice or community service. If you are advised, you will get a call back. We do not manage callback times or appointments. If you are advised you will get a call back or are waiting on an appointment, these will come from your local health board. Right care, right place. NHS Inform. Check your symptoms. Find local services and opening times. Health advice to help you stay well. Pharmacist. Coughs, colds, and sore throats. Aches, pains and UTIs. Diarrhea or constipation. Help if you run out of your repeat prescription. Optometrist. Red and or sticky eye. Blurred or reduced vision. Flashes and floaters. GP practice. A range of clinicians, including doctors and nurses, to help you with both physical and mental health issues. NHS 24. When your GP and pharmacy are closed, and you are too ill to wait, call NHS 24 on 111. If you think you need to attend A&E, but it is not life or limb threatening, call NHS 24 on 111. NHS 24 online app. A handy app to help you check your symptoms and find your nearest service. Mental well-being. Help for mental well-being, NHS Inform. Scott Mind to Mind. Breathing space, 0800 83 85 87. For urgent mental health care, call NHS 24 on 111. Dentist. Injury to mouth or teeth. Swelling in mouth. Toothache and general dental advice. Minor injuries unit. Cuts and minor burns. Sprains and strains. Suspected broken bones and fractures. 999 or A&E. For emergencies including suspected heart attack or stroke, severe breathing difficulties, severe bleeding. To check your symptoms, visit nhsinform.scot. Urgent care and minor injuries. If it's a life or limb-threatening emergency, you should call 999 or go straight to A&E. Urgent but not life or limb-threatening care. Phone NHS 24 on 111 for urgent care, day or night, if you think you need to go to A&E but it's not life-threatening. We will refer you to a local flow navigation center, FNC. You will get a video or phone appointment with a healthcare professional. These centers offer quick, direct access to emergency care. After your consultation, you might get self-care advice or be told to phone back if your symptoms get worse. An appointment to attend A&E, or a minor injuries unit. A referral to another specialist service. Minor injuries, cuts, sprains, burns. If you need to visit a minor injuries unit, MIU, our call handlers will contact your local health board. The health board can organize an appointment. An MIU clinician may call you back with a video or phone consultation, or they may ask you to attend the MIU for physical treatment. If you need emergency dental care. If your dental practice is closed and you need emergency care, our dental team will get the right care for you. You may get self-care advice or an appointment with a healthcare professional. Accessing our services in different ways. If English isn't your first or preferred language, you can use the free interpretation service Language Line for all our telephone services. To use Language Line, phone 111. Tell the call handler you need an interpreter and which language you prefer. If you use BSL, you can use the free BSL interpreting video relay service. Contact Scotland BSL. If you use a text phone, you can contact NHS 24 on 18 001 111 or by using the Relay UK app. Access to 111 in other languages. Callers to the 111 service first hear an automated interactive voice response, IVR, message with options to help them get the right support. You can choose to listen to our IVR messages in Arabic, Mandarin, Polish, Spanish, Romanian, Sorani, and Ukrainian. Mental health services. Getting help with your mental health. If you need an emergency ambulance or to keep someone safe, phone 999. Urgent mental health care. If you're distressed, suicidal or need emotional support, you can phone 111, choose the mental health option, and speak to our team of psychological well-being practitioners, PWPs. Our PWPs are specially trained advisors who work in mental health. They work alongside a team of mental health nurses to provide help and care for those with urgent mental health needs. They can offer advice on coping with mental health symptoms, recommend and connect you with other services, access a range of both NHS and other organizations to find the right support for you. Why people seek mental health support. People phone 111 for many reasons. The most common reasons include thinking about suicide, anxiety, low mood and depression, psychosis, self-harm. About breathing space. Breathing Space is a confidential listening service for people in Scotland. It's for anyone aged 16 years and over, experiencing low mood, depression or anxiety. How to contact Breathing Space. You can phone Breathing Space on 0800 83 85 87. Calls are free from landlines and mobiles. The Breathing Space phone line is available 24 hours at weekends. 6 p.m. Friday to 6 a.m. Monday. 6 p.m. to 2 a.m. on weekdays. Monday to Thursday. There's also a web chat service available at www.breathingspace.scot. What happens when I call Breathing Space? When you phone Breathing Space, a specialist advisor will answer your call. They come from a range of mental health, counseling, and social work backgrounds. You don't have to give your name or any personal details unless you want to. We understand that you might feel nervous about picking up the phone, and unsure about what to expect. You can talk at your own pace about what's on your mind or ask about helpful resources in your area. Minor illnesses and advice on medicines. Getting advice from a pharmacy. If you have a minor illness, a pharmacy is the first place to go for advice. You can go to any pharmacy and you do not usually need an appointment. For some common conditions, a pharmacist may be able to provide free medicines as part of the NHS Pharmacy First Scotland service. Examples are treatments for head lice, urinary infections, and emergency contraception. How does Pharmacy First work? The pharmacist, or a member of their team, will ask about your symptoms. Give advice on your condition. Provide medication under the Pharmacy First Scotland service, if applicable, or recommend an over-the-counter treatment for you to buy. You can ask to use the pharmacy's consultation space if you want to speak to the pharmacist in private. What to do if you're run out of medicine. Many community pharmacists can help if you run out of a prescribed medicine when your GP practice is closed. You can find out what medicines they may be able to prescribe from the NHS Inform website. www.nhsinform.scot Self-Help Guides Self-Help Guide Accessing Medicines.